Hello, my name is Stephanie Tangway. I'm an occupational therapist and assistive technology professional, and I'm the clinical education specialist for Motion Concepts. I'm here today to speak with you about the Invacare Matrx PSP cushion. The Invacare Matrx PSP cushion is part of our PS family. It's our second version of the cushion, and this, you'll notice, has a very different rear support material. We're using the exact same PS base, so you see our green high resiliency foam. We have the waffle shape relief area. This is I'm showing this on a small pediatric 12 by 12 size. And what you'll see in the rear of the cushion is an embedded polymer that's a grid poly, very, very thin material, still allows the bony prominences to move into it. So even though I have not a larger pelvis, we still have immersion into this material, have the benefit of the waffle shaping to allow the bony prominences to have deeper immersion into that aspect of the cushion. With this material, we're also seeing, because of the grid material, we're having a little bit better shear compensation because of how those little cubes can move separately of each other versus just a slab solid layer of polymer material. I'm going to talk a little bit about this in a adult size here, and what you'll see exactly the same across the size range that we offer for PS. We have for the PSP 10 through 20 wide. Those products are coded a little bit differently in the US market. This is a E2607 cushion. That would be meeting the code criteria for a skin protection and positioning cushion. And as a reminder, the big difference for that would be that the PS base without the polymer, that is an E2605, a positioning cushion. So here's an example, a standard adult size, 18 by 18. You can see how the polymer target is embedded. So we're capturing here both material underneath the ischial tuberosities, and we see it come up to also give a little bit of additional protection as we transition laterally to the greater trochanteric area, right? And so ideally with this, we have our abduction for our femoral alignment. We have our pre-ischial buildup to help maintain the position of the pelvis in the rear of the cushion on these adult sizes. And as we have the weight bearing of the consumer, the ischials are able to move down into that waffle target. We drive more of our weight bearing out of the greater trochanters and through the femurs. Lower risk area for pressure injuries to occur there. And so that's where we're always trying to get a lot more of our load. It also gives us our pelvic support and stability. The covers for the PSP, in keeping within our PS family and consistency, we are providing two covers. We have our inner cover, which is our reverse Startex, zipper rear close, great moisture barrier to help protect our high resiliency foam. And then we have the outer cover with our logoing Invacare Matrx PSP. And this is also the Startex material, and this cover is sewn as a reversible cover. So labeling front left corner, seams and Velcro are on the bottom. We turn it inside out. Still have our labeling on the front left corner, and the seams and Velcro are still on the bottom. So this very unique reversible outer cover gives you the ability to have two layers of moisture barrier protection. This is a very nice material that allows it to be wiped or sterilized in between assessments or multiple times throughout the day. So a lot of versatility. What I especially love about our bevel cut front would be somebody who is needing to position their feet, get a little bit more knee flexion in their feet positioned underneath them for a transfer. The other thing you'll notice with our cushions is that we use a extended rear radius. We have these rounded corners on the cushion in the back. and we have a slightly extended rear radius. It actually makes each of our cushions slightly longer if we measure on the top surface fore to aft. So the cushion is actually designed to tuck all the way into the back canes and will extend to give a little bit more surface contact to the posterior pelvic tissue distribution.